Is public health specialist Dr. Tui Mebawadu. Good morning, Doctor.
Good morning.
Thank you for joining us on TVC Breakfast. We have hit the over 10,000 active cases mark. What does that mean for Nigeria? Are we inching closer to a third wave?
Thank you. If you look at it, as of January 22 this year, we peaked at about 2,400 cases in a day, and gradually we've been reducing the numbers. But in the past 14 days, we've had more than 1,000 cases, new infection cases. Even at this number may not represent the true reflection of what is happening in Nigeria, because we've just gotten to 1% testing. 2 million people tested in Nigeria.
In a year?
2 million.
Of having this COVID-19 in the country. 2
million people tested. And then here we are, in the last 14 days, more than 1,000 cases. Like you already pointed out, 10,000 active cases. And the challenge is that once we have those number of active cases, that means that the transmission of the disease is real. And then if you now juxtapose this with what is happening, India, entering third wave, Delhi third wave, there's a mutant strain spreading from India, a mutant strain from Brazil, another one from South Africa. There's even a Nigerian strain that is ongoing now. So you see all those strains combined together. We see our relationship with India, we see our relationship with Brazil, and even the other part of Africa. Effectively, Italy, France, Germany, India, they are in third wave. And really, you remember that Germany actually wanted to do a lockdown in the past few weeks. So the threat is there. And then let's look at it. What Britain has done is to vaccinate itself out of COVID. 70% of the population are now having that, that antibody that can protect them. Wonderful. But what has happened to us? We had how many doses? About 3.92 million doses of vaccines supplied by COVAX. Who is our supplier? Serum Institute of India. Now they are stopping exportation of the vaccine. In fact, they got the Johnson & Johnson vaccine from US to support them, okay? They've stopped exporting. So where do we get vaccines now in Nigeria? Even the vaccine that we got, what have we done? We've done just about 1.19 million vaccination over how many months since we started. And then that means it's not remarkable. Because normally I was thinking that by now we should be getting close to 2 million, even that, at least 2 million, 3 million. But the big question is that even the vaccine resistance is still rife in this part of the world. People are doubting. Even the availability of the vaccine is questioned and queried, because there are a lot of, background handlings, the handling that's going on that these people are not really happy about. So we're not vaccinating. And then the thing that happened, let us learn from India. Narendra Modi, the Prime Minister of India, just woke up and said, oh, we've defeated COVID vaccine, open up religious worship, open up campaign, started running around, allow people to be running around, and then they were hit by the second wave. Now, the same thing applies here. We have a triple whammy on our hands. We have insecurity spreading massively. We've opened up our space, In fact,
life seems to have returned to normal.
Yes, everybody just feels that, we've defeated COVID vaccine. I'll say, some try to justify that. Listen, we've said it all the while. COVID vaccine is a scam.
COVID-19.
COVID-19 is a scam. Now, we've moved to the stage of India, you understand? And then we're not taking the necessary precaution. Can you imagine a COVID-19 in a depressed economy, COVID-19 in a state of insecurity, and a third wave where we've neglected everything that has to do with
the safety protocols?
That's where we are now.
One can only leave it to the imagination, because we can see how devastating the impact is in India. And then to bring it here, it's not something one would want to imagine.
Especially where you don't have any health system. You remember you just went on strike?
Yes.
It's just a mess.
A complex issue.
It's just you see, I've always looked at Nigeria. The Nigeria problem is a wicked problem. A wicked problem has a lot of complexity. You don't know what you do to solve the problem. The answer is not yes or no. It brings another dimension that you have to solve.
You have to think it through.
It has a multiple dimension. So how do we resolve a wicked problem? That is the, you need a statesman that can look through this whole process.
But if we had prepared appropriately, would we be having this wicked problem, as you put it?
Yeah, you know, yes, because again, that's the key issue. You know, because everything is pecuniary in Nigeria. That, okay, once this thing cannot put money in my pocket, personal pocket, my pocket, I'm not going to do it. You know, and then
corruption in health.
Oh, obviously, which area? Because number one, you have to appropriate money for health. You have to disburse those money. Okay, you have to go through a process, and it's not the money will not just fall on health like that. It comes from a source. Okay, so now the point: what are we doing in that regard? Now, if you have to face a health challenge in this kind of economy that is having a problem, you know, you are facing health challenge when there's no health system. You are facing health challenge like COVID-19 pandemic when you are having insecurity all over the state. It's a huge issue. Even more importantly, the vaccine that we're supposed to use to be able to achieve some level of herd immunity, we're not going to get it. Except you now have to go to Russia or beg China. That is the only place where we have to
now,
go.
Let's look at the efforts across states. We see what Lagos State is doing, but because this is also critical when we are looking at how we are doing in terms of managing the spread of COVID-19. When you leave Lagos, even at its peak at the time, you look like an alien in some states when you travel, when the roads were open for everyone to travel. When there's people see you wear masks, they know that you are from Lagos. And that is concerning for a lot of persons, the effort, because we need to galvanize efforts, come together as one to really address this issue.
Indeed, we must be able to act locally and effectively. This is just, you know, because what has happened is that they've seen the disease as, you know what, this your educated people wahala, you know, and like rightly said, once you move out of Lagos, nobody cares. Nobody wear masks, nobody does anything, nobody follow your social distancing, and then the parties are back fully, you know.
Are we providing that needed leadership?
That is the key issue, because again, every state must be able to act locally, you know, even at level of local government. What is the big deal in assuring people that, listen, you have to wear face masks? In some instances, why can't we even provide face masks in critical places, marketplace, for instance? You know, people can just come in and put a face mask on when they have to get engaged in the market, put people there to excuse those ones that are not wearing face masks from the market so that they don't spread the disease. When they see that kind of thing, because they want to sell things, they will comply. You must be able to actually put some proactive thing, you know, that will make it easy for them to get that face mask, easy for them to even wash their hand, if that is possible. Because at the end of the day, that is the cheapest thing we have to deal with the virus. And then, let's face it, we're having multivarious challenges as far as health is concerned. We can't allow this to be superimposed on our already precarious situation. So I don't just honestly know how to say it again, but I have said over and over, it has to come back to you personally. You know, do I want to risk my life?
That's the individual taking responsibility.
That's where we are now.
Right.
Do I want to, even whatever everybody is saying, you know, if the vaccine is available, have I taken the vaccine? If you are not taking the vaccine, do you want to risk yourself? Do you attend parties recklessly? Do you go around without putting on face masks and all those things? You know, so let's move back to individual, because we've seen that leadership is supposed to help us drive this thing. They are pussyfooted on everything. Indeed, you know, because the whole of Africa, the same population with India 1.34, we Africa 1.3 billion people. And look at the vaccine that has been deployed. Out of 580 million doses of the vaccine deployed worldwide, just 80 million. 80 million in Africa. That 80 million, even some countries are either destroying the vaccine because it has expired. Namibia is an example. Some are trying to find a way to return the vaccine to other people. Congo is an example. And even, you know, so we even saw our own situation that we could not store Pfizer vaccine, Pfizer-BioNTech vaccine. So a lot of issues concerning this thing. So shouldn't
that now spur the African continent to come together to say, see, we need to sit together and proffer solutions for ourselves to addressing this issue. We can't keep waiting, because at some point, the Vice President was saying we need to avoid vaccine nationalism. And the question is, if we need to avoid that, shouldn't we be looking at homegrown solutions?
Yeah, 4.5 million cases of COVID out of the whole 150 million all around the world. 4.5 million in Africa. Because most likely they are not testing. You know the late Magafuli, who was actually not interested in COVID and vaccination. South Africa, 1.5, Morocco and Algeria, another high figure. The rest are just tiny things like that. And the key issue simply is because there's no testing. There's no testing. South Africa is doing a lot of testing. You can see more of the figure. Then the core team, the African Regional Office of WHO, should be on top of how to collaborate. We have universities in
research institutes,
Africa that should say that, listen, guys, let's mobilize funds for you. Try to figure out vaccines for us, okay? I mean, these guys that are doing the vaccine, they are not more brilliant than anybody. It's just they are organized.
Some Nigerians are even part of them.
I can tell you authoritatively, look at them, they're not more intelligent than you.
Right.
They just have an organized thing that's, okay, we want to focus. They have funds, they have organized, but it's okay, listen, we want a focus. Because let's put that, if you look at our big pharmaceutical industries around Africa, and you say, listen, like Donald Trump did before he left, who gave as much as $4 billion to say that, listen, Pfizer, develop vaccine for me. Can't we African, AU or whatever they call themselves, move together and say, listen, this amount of money, take this institution and that institution, take, do a research, collaborate, and get a vaccine for us. And that shouldn't be too difficult. This jams, developing vaccine, all of us know the technology now.
Absolutely.
What is the big deal? It's not a big deal. It's just people coming together and saying that, listen, are we using adenovirus? Are we using the other model? You develop and test.
We have the human resources.
We develop and test.
Right.
You need that bold thing, because before you know it, China will give you condition for its vaccine.
Right.
Russia will tell you this is what he needs to do to give you vaccine. India is shutting up his own vaccine. Say, listen, I have to address my situation in my house. And you're right to do that. So, so what's the big deal that a Yaba, for instance, or National Institute of Virology somewhere in Jos cannot figure out a vaccination? Sad.
Really sad. And still talking about testing, some persons have said that perhaps we should deploy testing to the level of primary healthcare centers so as to spread the testing just as we see for vaccination.
It will be beautiful, because what will work in that situation is a rapid test. Right. Because the PCR has some complexity to it that you may not have the requisite human resources to drive. Okay? But if you can develop a rapid test that can be trusted, okay? We're
already using it for the orientation camps. Isn't that what we are using for the
Nice. What is wrong in taking that rapid test to the local government? Yeah, anybody that comes in here, do a test. Now, what that one does simply is this. I know there will be some false positive and false negative, okay? But at least huge number of people can be tested. Those ones that are positive, we can then further, especially if they're showing signs, further go ahead and do a PCR for them. We must create a simple algorithm that will help us, define this thing and clarify it properly. But it seems, we're lucky. We have holy water. We have recitation from different holy books that can help us. And that is the worrying level of magical thinking. That is very worrying. If I were to be the Minister of Education, I would call the National Institute of Education Research and say, listen, go and reorder my curriculum. I can't have this kind of population thinking like this. And then I think that I'm going to grow in this country. It's worrisome. People use faith to drive science. But in this part of the world, we use faith to fight science. It's not, why should that be?
Right.
Why should that? Because again, the fact is that it is not possible for you to preach and preach salvation of a dead person. Still, the person is still alive. The realm of science is that we're trying to keep you alive. Why the fight? Why are you fighting science now? So again, these are critical issues that, you know, you wonder, where is our problem coming from? Our problem is coming from that level of thinking that should assure life, that should challenge ignorance and superstition, and then know that, listen, I want to stay alive. Well, I have a space. You see, life is just a space, birth and death. That space, this is what I have. I need to keep myself alive in this space. You understand? I need to make sure that things happen. I need to impact on people in this space. So is that space now that people are crowding with magical thinking? Where do we go from there? Well, we keep talking, and that's the best we can do. We just keep talking and figure out that one day people will understand that washing your hand, keeping social distance, wearing face masks is not anti-God, it's not anti-religion.
Now, one key aspect that the PTF recently spoke about is stemming from what is happening in India and perhaps across the world as well as Brazil, is that there's the need to develop capacity moving forward. Now, you're smiling, I don't know why, but then if we are looking at developing capacity to really address this issue, avoid a third wave, where should we begin?
Again, let's look at what is possible. We can use all sorts of grammar and try to sound nice. These are tired repeats. It's even an expired, not tired, expired repeat. This thing, you do capacity, this and that, this and that. No, we're not. You see, the critical thing that can happen that will be meaningful is for the PTF to say, guys, okay, is it money we need? Let's push for preventive measures. What are those protocols that can help us, you know, prevent those things? The protocol will not, for instance, if you have to look at, let's say, Kuje market, or say, you know, Tinubu market, or Riara market, and say that, listen, we don't want, this could be a source of spread of the virus. What will you do? Guys, some of these school leavers, let's train them on how to talk to people, how to ensure that we deploy face masks, how to, you know, how to deepen knowledge in that regard. You deploy them to those places.
That knowledge gap has to be bridged.
Huge knowledge gap, because we need to fight vaccine hesitances, we need to fight conspiracy theories, we need to fight ignorance, we need to fight superstitions surrounding, because those are the deadly things that kill.
And then there is the need to build trust. Yes,
you need to build trust. So now you bring those small, those young guys and say, listen, you know, you are doing, you act, you do this thing, so person, help me do this information, help me do that, go to this place, let's see whether we are, and then test what is the knowledge of the people, what are they doing? You know, those are the reasonable things. If you're thinking of getting a doctor or nurses, they're on strike, they will go back on strike now. If you are thinking of building hospitals, how many hospitals do you have? How many resources do you have in the hospital? So what else are you going to do? If you are thinking of giving vaccine, you don't have now. India is saying that they are not selling their own. China will come with their own condition. Russia will come their own condition. You are left in the cold. What are you going to do? So the right thing is for us to deepen that information gap and ensure behavior. In fact, reward behavior that tend to promote health. These are critical things that you can do that is low-hanging fruits.
Yes.
For your country. Right. If you can repeat all these things, we are doing that. That is a story. I've heard that over and over. It's expired.
All right. We'll leave the conversation here. Public health specialist, Dr. Tuimi Bawandu. Thank you so much for your time on the program.
My pleasure always.